Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
Today we're talking about patients who seek plastic surgery and treatments, but maybe they don't need them. Why this happens and how do we handle it? So,
we have some examples of some, usually people come in with names in their heads of like some actors. These are the actors, right? Or like famous people. And they'll say like, do not make me look like Katie Price, or do not make me look like, I don't know, Courtney Cox is the big one that everyone's saying, don't make me look like her. And probably heard it like twice today.
So the question is, what's wrong with those people if they do this? Like, how come Katie Price, whoever that is actually, or Donatella Versace, or these various people, how do they end up looking?
I think they go to doctors that don't know how to say no. We as women, we learn how to say no. So why can't men surgeons say no?
Well, we say no. I think what happens with some of these people, I tell patients this, I go, look, I'm not going to be the one to do this for you. But if you go and interview enough surgeons and you knock on enough doors, eventually you'll find someone who will, you'll twist their elbow and they'll say, okay, fine, we'll do it.
That's true.
Or, I just think that, you knock on enough doors, you can get things done, and that's what some people do.
Well, first of all, I think men are good at saying no just to different things than women, such as pick up your clothes. No. Fix the broken fence. No. I think we don't say no. I think we just don't do it.
Okay,
so it's a different kind of no.
So it's good to learn to say no.
But here's a question about this. Are the patients coming in, or in this case, these sort of well-known celebrities, are they coming in and requesting things that they shouldn't have? Or are they requesting appropriate things and getting bad answers? In other words,
that's interesting.
I have a feeling that some of these people went in and said, I'm looking older, what should I do?
Mm-hmm.
And they go, oh, you need a filler, or you need a facelift, or you need this or that. And then they come out looking crazy, but that's their new thing. And now what are they going to do about it?
Because you think they're getting bad advice.
I think sometimes it's not that the plastic surgeon had to say no. I think it's that the plastic surgeon needed to do the right thing, and they don't, or they gave them the wrong treatment. You have to wonder, we see this mostly with celebrities, and you have to wonder, it's a combination of things. Like what goes wrong in Hollywood with the doctors? That the doctors produce this. No one thinks it looks good, and that they don't really either. There's no way these people can look in the mirror and go, I actually think I look good. So what happens when you open up in Beverly Hills or Southern California? Do you suddenly become a lousy doctor? Or is it what Dr. Tower said, that they're like, I better do something or else famous person's going to go next door.
Yeah.
And then they do something and it's not right.
They know that eventually someone's going to do whatever this person is seeking. And so they go, I may as well be the one to do it.
Or maybe they just need to come to the East Coast to get it done right.
Well, that's for sure.
That's true. They should definitely do that. There's no question.
As you know, we can't talk about them, but there are those who are smarter. And I'll give you an example of a patient that we've seen who's not a celebrity, but this is someone who came in and said, I want my nose changed. And she told me all these things that were wrong with her nose. And there was nothing wrong with her nose. So this was a person who had some version of body dysmorphic disorder, which is a psychological or psychiatric condition wherein you think there's something wrong when there probably isn't. Yep. Right? And it's a subtle thing, and it can be kind of difficult where sometimes you say, there's something wrong here, and it's kind of questionable, like, I'd be very happy with that nose, but I can see that you could be even better, right? Mm-hmm. And that goes to a different topic where you can't always judge how good looking a person should be. Someone comes in with a pretty good looking nose, and you're like, I would just stop, you look great. But they're like, I can be the best looking person in the world if you fix this, and then you can fix it. But the person I'm talking about came in, and truly there was nothing wrong. Mm-hmm. And I said to her, you should not be doing this she was obsessed with her nose and obsessed with all kinds of things that weren't broken, right?
Yeah.
And I said, no, I'm not going to do this. And she left very angry. And she came back about 4 months later, having had nose surgery by someone in town or in Massachusetts. And now her nose was messed up.
Yeah.
And so now I had a big problem because now I know that she can't tell when things are good, but things are bad.
Mm-hmm.
So do I fix her or not?
Yeah. And you've
It's a
had
tough
that
one.
happen when you had another case where you said you fixed the nose. It wasn't great to begin with. And then they had like they sought out different surgeons around the country. On the 7th run, they came back to you and said,
many times.
right?
I wish
and
it
they
was,
said,
I wish I'd
I
stayed.
wish I'd stayed and never done that. And then now you had to do like the 5th revision, bringing them, or the 6th, 7th
And
revision, bringing them back.
not to disparage Southern California, but what happens is these people come in, they got the ones you're talking about, they had their nose done. They flew out to see some Instagram famous doctor, spent a ton for like a facelift or something, which they could have gotten done here. And then that doctor says, oh, while you're getting your facelift, why don't we do something to your nose? And like, oh, I didn't know something was wrong with my nose. Like, well, I could do this or that. And so then they do it, and then they come back and they want everything fixed.
Yeah. So that really, that goes right back to what you were saying, that you go around, you're going to find someone who's going to be willing to do it.
It reminds me of a conversation I had just the other day with someone who I'd done her rhinoplasty, and one of the things she wanted was a narrower nasal base, wanted narrower nostrils. So I did her alarplasty. It looks great. Her mother thinks it looks great. I mean, just objectively, like you look at the photos and you're like, yeah, this is a better version. This is what you asked for. And she goes, well, but could it still be like narrower? And this is where I have to say, how long do you spend in the casino? I mean, basically, like, yeah, I mean, theoretically, you could cut out more skin, but there's a line. It's like Price is Right rules. If you go over, you lose.
That's right.
And so you can get very close to the right price or the right amount of surgery. But if you do too much, you inevitably lose.
That's
so
correct.
It's like if you're winning in the casino, sometimes you take your win and
you got to know when to
leave the
hold them,
casino.
know when to fold them.
Exactly.
Yeah.
So that's. I don't like to compare us to a casino. I think we're better than
No.
just random.
Right. Don't leave
odds,
anything
but-
to chance by coming.
But you understand that it's like a gamble. Anytime you're cutting into skin, you're always taking a small gamble. So,
That's
And
100% right.
And I think the same thing goes a lot for a lower bleph. Sometimes people just want it really straight and it looks really, really good, but you need just like a little filler there to just give it just like a little hydration. So when you put that filler in there, the hyaluronic acid filler, even after you've done the blepharoplasty or before you do the blepharoplasty, that hyaluronic acid stays there and just keeps things nice and fluffy. Like, because you don't want the skin like too tight. You want it to be human, just like a little bit of zhuzh, what we call, just like a little bit, just hydration there. Does that make sense?
Yeah. Here's a question I have for you, because I wonder if this is a red flag that I see sometimes. Your patient reminded me of it. When somebody takes out their phone, they're trying to show you what's wrong with their appearance. And I said, well, here's a mirror. Why don't you point out? And they said, no,
yes.
I've got a photo reel of all the things.
That's right.
But it only happens when the lighting is like this and I have to have my face
That's right.
scrunched in a certain way, and then you can see the wrinkle that's bothering me.
Yeah.
That's
And
exactly
I go, I
right.
don't know if I can treat that.
It's not there in a
wrong.
mirror. It's only
Exactly.
there in a photo.
If you can't reproduce it just while you're sitting there in front of me, then there's no way I can treat this.
That's
But I
this
do have
problem.
to tell
And
you,
at some point, it's like, is it in their imagination? I mean, if you have to show me the photos like
so
this.
what I started doing is I come with an iPad with their pictures. So it's like really large. It's not phone size. And we just took that photo. So you can't
moments
lie.
ago.
Because, we just took that photo moments ago. It does not lie. And they've got it like really enlarged. And then when they want to go to their phone, I'm like, no. You've got your picture
it's
right
right
there.
picture we
It's
just
right
did.
here. Yeah.
And actually, what
Not
I've
from
seen,
last year.
Yeah, but what I've seen is they stopped going to their phones. Whereas when I was just taking the mirror, they still wanted a photo. They wanted to show me a photo.
Yeah.
But when I show them a photo and it's really enlarged, they almost never go to their phone anymore. So I learned that from someone just recently after like I don't know, more than a dozen years bringing in the mirror. I now bring in the iPad, and it solves all those problems because we got that photo.
Yeah.
You know,
And it was just
a couple of comments as we wrap this up. One is that there's a famous quote, which is "the enemy of good is better."
Oh yeah.
Right? And that's something that people need to remember. When things look good, sometimes looking better, it can always be better. And an interesting statistic is that if you ask married couples how, on a scale of 1 to 10, they rate their spouse, it's always an 8.
Yeah.
No one's ever married to a 9 or a 10.
Yeah.
It's always an 8.
And
I could think
You?
of something. Some room for
Everybody
improvement.
else.
Yeah.
And
no.
everybody
no,
else.
what's the number? What's the number? Come on, what's the number? You brought it
What
up.
comes after 10? And and the other comment is that on celebrities is that, you know, we got asked a comment from a reporter from the Huffington Post even today about people using celebrities as role models in getting plastic surgery.
Yeah.
And what happens is these are just faces that you see.
Yeah.
Right. So you see those faces all the time,
Well,
and you know what's changing, right? Like you can't come in with a photo of the lady you just saw at the grocery store and go, look how much better she looks. Like I never saw her before today, you know? Good.
So, yeah, absolutely.
I was going to say, one of the things that surprised me, this was like a year ago. And, you know, we say no to people all the time. But one that sticks out in my head was like a young, beautiful woman. I can't remember if it was buccal fat removal or a lip lift or something like that. And I said, sorry, you know, I just don't think there's anything I can do to improve your appearance. Like, you look great.
Yes.
You know, like, what are you doing here?
Why mess with success?
And I thought I was saying something that was going to really disappoint her. She had paid a consult deposit and, you know, made the trip to come here to get my advice. And she goes, you know, that's actually like the greatest compliment anyone's ever given me. Is coming from a plastic surgeon who's like, you don't need to do anything.
And
Credibility.
then she keeps coming for Botox. So what could be better?
Well,
You know,
You know?
and
it's sometimes it's just best just to say no.
Yeah.
that's right. And one final thing about saying no and stopping when the time is right. A similar study to the one about rating your spouse an 8 is that you can take a photo of beautiful people and you show it to the subjects and you say, who's the most beautiful person you can think of? And you show them that face. And then you say to them, now what would you do to make the face better? And there's always an answer.
Yeah.
There's
always
nobody for whom anyone says it's perfection.
Yeah.
That we're done. So that's a key thing. You always have to stop before you go over the cliff.
So what's the one like, is there anything in your memory that you're like, what's the most common? Because I know for me, what's the most common thing that I always have to say no to? Not always, but if I had to say no to something over and over again, I know what it is.
What is it?
Oh, I know what mine is.
Okay.
You go
Mine
first.
is lips.
Stop.
Everybody always wants more and more and more, and then it just starts to look crazy.
Mhm.
So you have to have your stop point, and you have to have a ratio and all
You
of
have to have
that.
someone
So
you
that's
can
the one
trust.
place.
Yeah.
Oh, and I do have to say, some people have like their nose is just a little crooked and they want non-surgical rhino. And I always say I can fix the bump, I can raise this up here, anything on the ridge, but I can't make it side to side perfect because if I make it perfect and symmetrical, your nose will be wider, and no one ever wants a wider nose.
That's right.
So
Yeah.
that's my number, my
Those are your
top
1 and
2.
2.
Yeah, mine's same category. It's just over volumization. It's just people
Fat
have been
grafting.
sold volume loss, and therefore augmentation is the solution to like everything. And there's just like, I just won't inject.
Well,
people
gaining
if
a
I
lot
don't
of weight
think they're
makes loose
gonna-
pants fit better.
Yeah. So I think this most common thing that people are seeking from me that I'm not excited about is over volumizing, like just injecting too much filler, I would say.
Yeah, we have to do everything just right. And for me, the thing I'll say no to is that picking up my clothes thing. Okay.